I wanted to just remind the members here that the Republican members spent $800 million subsidizing insurance companies. 800 million, not 44, I think was what the number you were talking about, Representative Albright. $800 million subsidizing insurance companies in the hopes of bringing down premiums for the Minnesotans in all our districts who are paying full freight for private insurance, right? 800 million. And there is very, very little to show for that. Let me remind you of that first of all. When we talk about what the money could do, Representative Albright, you bet this money, the 800 million and the 44 million and every dollar we have here to spend could do a lot of good. But remember what this committee did with extra money. Remember what the Republican majority does when it has extra money in Health and Human Services. Because the forecasted programs, the way the budget works, those dollars ended up getting spent in the last budget cycle on tax cuts. Tax cuts. You don't spend them on those people that were here in the wheelchairs. You don't spend them on the opioid crisis. You spend them on tax cuts, mainly for wealthy people. That's where the money goes. So don't give us a lecture about where that money could go, because you're not putting it there when you've got it. So that's the first thing. And when you do have money and you decide to spend money, you're spending it on insurance companies, not the Minnesotans that need it. So now let's talk about the MinnesotaCare buy-in option, not MinnesotaCare for all. Let's not confuse people. This is an option for those people for whom that 800 million is not doing the job. So what you are doing here with this amendment, Representative Zerwas, is punishing those people who need an option because that private market is not working for them. That 800 million you spent, part of it, granted, was a waiver that didn't waive anything, that just cost us more money. So what you're doing is taking away an option that would be a good option for those people. Now you wanna pound on DHS, and you know, I agree in some respect they deserve it here today. I'm not gonna defend their failure to collect those dollars they should have collected. Nobody can. And I don't think Mr. Johnson is sitting here saying that that was okay. He's not. But we can either look backwards or we can look forward. We all have constituents who cannot afford insurance anymore. They need insurance. They need help. This is an option for them. So if you want to punish your constituents who need an option that they can afford, that will give them an actual network of providers, which a lot of those private plans, probably all of them, none of them give a real network where people have real options in some of these rural areas. You want to take that option away? That's what this amendment does. This is an amendment that hurts your constituents who want to buy insurance and can't find it. Because MinnesotaCare has networks all over the state, and it's been, as Representative Loeffler was saying, was it 27 years? It's been a very good program, and it could work very well for Minnesotans who need that option that your $800 million expenditure did not buy for them.